it's just really thinking about the core of the social determinants of health and how each piece of that can really play a key role in how someone succeeds throughout their life. And for us, one of the things we realize, and you'll know this as a like everything is so siloed, and so it makes it really difficult for a average everyday resident to be able to access the services that they need when they need them without having issues. And so one of the ways we're actually implementing is a new program that we're doing and that we're working on. We're hoping to launch it in July very soon. We're kind of all access centers.
Welcome to An Honorable Profession, a podcast focused on incredibly talented people who've dedicated themselves to public service when their country and communities needed it the most. I'm Ryan Coonerty. Along with Debbie Cox Bolton of the New Deal, I'm lucky enough to be your co-host. The New Deal is an organization that supports the next generation of American leaders. Check out newdealleaders.org to find out more. Delaware County Council Chair, Dr. Monica Taylor, welcome to An Honorable Profession.
Hi, thank you for having me.
I thought we could start with the many titles I just listed off. Let's start county chair, doctor, all the things. You've had a fascinating path to public service. Can you tell us a little bit about how you found yourself in the position you are today?
Yes, I can. If you would have asked me a decade ago, like if I would be in politics, I would say no, probably not. I'm currently a full-time professor at Temple University in the College of Public Health, and I really have my eyes set on being in higher education administration. And then I decided to run for office. I decided to run for school board. I wanted to figure out a way to contribute to my community, and with my background in education, and also I have little ones who are in our public school district. I just thought that would be a great opportunity for me to give back to the community and help where I could. And so I was working in the school district. Absolutely loved it. I know most people don't necessarily say that. When you're taking care of everyone's little ones, you have some really passionate people who come to talk to school boards.
By far the hardest level of government to serve at. By far.
Yes, but it's very rewarding, right? Because you get to really see your impact immediately. You see what's happening in the school district. You see the changes and all of the positive impact that you can have on a student and a community. Our school district was 14,000 students, and so it's a really big school district for Pennsylvania. And so I was one of my passions as a college professor was really trying to help the students who were in our district who weren't going to college for whatever reason, to know what their options were, to really understand, where they could go and have a family sustaining wage. And what I started to do was we had done a study in the school district to see where those students were going. And what we found was that a majority of them were going into retail jobs or jobs that really didn't have any upward mobility opportunities. And I started to kind of look around at what other counties were doing. I started to use resources from Philadelphia, utilize resources from the surrounding collar counties around Philadelphia, to really try to open their eyes up to, what are the opportunities. I reached out to the building trades. I reached out to the tech companies, started to talk about those different job areas that people could go into where you don't have to have a college degree, but you really have an opportunity for upward mobility and a family sustaining wage. And what I realized is that there were so many things that were happening in all the counties around us. And I started to look into our county, and it was just like, well, what's happening in Delaware County? Why don't we have the same programs that everyone else does? And I'm only one district in the county, and there's 14 other school districts. What's happening in the other school districts? And are they also missing out on these resources? And then that made me look more into what was going on in county government. And when I looked in, I realized that we were the largest county in the country that didn't have a health department. And I also realized we were the only county in the Commonwealth who had a privatized prison. And our workforce development, we were actually sending almost $1 million back to the federal government of dollars that we weren't utilizing to spend in our county. So that's really what gave me the idea to run for county office. I was like, well, maybe I could do something to change this.
Can you explain a little bit of how Delaware County got into this position? I mean, I've spent 8 years in county government, and a health function is one of the core responsibilities of county government in most places across the country. How how do I guess situate for our listeners Delaware County as what it's like, what's there, and then sort of how it got into this situation of maybe not providing the kinds of services and policies that would benefit its community, and why you're out to change it.
Right. Well, so Delaware County is a county in Pennsylvania that's right in the western suburbs of Philadelphia. And so we are a really diverse county, and we have everything from the typical suburbs to a really urban area, Upper Darby, where I'm from, which is right next to the city of Philadelphia, to rural in the other side of our county where we have horse farms, right? We have a little bit of everything here, and it makes for a really wonderful place to live and to raise a family. And we have almost 575,000 residents here. And what here when we won in 2019, we actually won our first election in 2019. We actually flipped the county government, and the county government had been a one party rule for decades. And when we flipped the county, it was actually the first time that it was a Democrat majority since before the Civil War.
Wow.
So it was a really big sea change, just really different priorities in the previous administration than when we came in. And so that's kind of a little bit of how we got to where we are.
And can you talk about flipping? Because I feel like so many places feel like they've gone the other direction or it's flipped back and forth. But it feels like there's been progress made on building a sustainable majority and good policies that come with it in your community. Can you talk a little bit about what's happening on the ground, and then maybe for the rest of us that live and die by the election results in Pennsylvania every 4 years, what it means for the rest of us?
Yeah, it's really been almost 10 years at this point of just building the party, recruiting really good candidates at every single level of government. And that's your local school boards, right? I started out in school board. It's your local council person, your township council or supervisor. And so we've really systematically built the party and built committees and have increased the number of boots on the ground. And what I mean by that is people are out there. Our committees are out and canvassing in their communities every single year, every single election, even if it's not a municipal election. They're out there during the state election. And it shows in our results. Delaware County has increased Democratic turnout every single year since 2016. I believe. And so 2017 was the first year we ever run countywide. Democrats ever won countywide. And then 2019, we flipped it. But in between that, 2018, we flipped several state house seats, several state senate seats. We flipped our congressional seat. And each year, we've increased the voter turnout in Delaware County.
Amazing. Can you talk a little bit about obviously having boots on the ground and people mobilized and great candidates is great, but also the issues and messaging is what resonates often with voters. What are the issues that are core issues on the ground that are translating that success?
When we ran the first time, it was really talking about those key issues. It was like workforce development, like we're sending money back to the federal government that should be utilized to help folks in Delaware County figure out their career paths, right? And health department. Most people, when I knocked on doors, and I knocked on thousands of doors in our campaign, and people, oh, I thought we had a health department. They were so shocked. And this is pre-pandemic. Um, and then we rolled into being sworn in January 2020 without a health department. And then talking about the prison and just, talking from our personal perspective of, a prison should not be privatized. And that's what I thoroughly believe, because there's a moral issue there at stake when you think about somebody's making money off of keeping people and keeping the beds full in a prison. And there are all sorts of issues with our prison because of that. And so I think really talking to people about the issues, and as we've moved forward, it's continuing that, right? It's okay. we have housing issues. Everybody has housing issues across the county, right? And trying across the country and trying to talk to folks about making sure it's affordable. You know, you have students who are coming back and graduating and they can't find an apartment because they have to live at home because they can't afford anything, right, on their first job, or all of these different things, or thinking about the unhoused population and how do we help support them more. That really seems to resonate with our residents, and they want to be able to help. And it also helps that what we said we were going to do when we were running for office, deprivatize the prison, create a health department, expand our workforce development, we did that. And we accomplished those goals, and then we keep the public updated on it.
I guess one of my questions is you obviously have a distinguished career in academia and looking at issues around public policy and impact. How 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 has being in elected office informed your work, your scholarly work, and vice versa?
Um, you know, being in public office has informed just thinking more about the impact of public health. It's one of the areas I come from. That's, you know, my research and the work that we do at the county level is just thinking about health in all policies. And when you think about it that way, it's really about how those social determinants of health really impact everyone and every aspect of government. When you're thinking about economic mobility and how that impacts their access to education, access to jobs, and access to training. And when you think about having access to healthcare and how communities um, who are less healthy end up being, you know, subject to so many different things that kind of put them on a spiral, a downward spiral. And it's really, how do we bring those policies to front? How do we make sure that areas that have been underserved or um, underrepresented get help that they need or get access? And that can look like so many different things and through so many different departments, especially at the county level, because we really are the boots on the ground level of government, especially in the Commonwealth, because we take the funding that goes through the federal government to the state, and our human services and social services, our senior services work, our veterans work, our children and youth services, those, all of that goes through the county. And so it really makes a big impact on how we serve our residents.
Can you tell our listeners about this health and all policy strategy? I mean, I think one of the things in reading about your work, I've been impressed at how widely you define health and impact, and how you look for cross sector and cross departmental collaborations. Can you talk a little bit about sort of the philosophy behind it, and then how you implement it in Delaware County?
Yes, you know, it's just really thinking about the core of the social determinants of health and how each piece of that can really play a key role in how someone succeeds throughout their life. And for us, one of the things we realize, and you'll know this as a like everything is so siloed, and so it makes it really difficult for a average everyday resident to be able to access the services that they need when they need them without having issues. And so one of the ways we're actually implementing is a new program that we're doing and that we're working on. We're hoping to launch it in July, very soon. We're kind of all access centers, right? And so when we think about the umbrella of social services, when we look at the state, they're all siloed, right? The veteran services, our senior services, our housing services, our mental health, our behavioral health services, drug and alcohol services, they all kind of come through a different stream and are all siloed through kind of, that's how the state functions, right? And so that's how it trickles down to the counties. And but that doesn't really make sense on the ground, because what if you have somebody who is a 65-year-old veteran who is experiencing housing insecurity and food insecurity, and they also have some mental health or behavioral health issues that they need support with? Currently, the system is set up that they have to go through 4 or 5 different offices to get the services that they need, but it doesn't have to be that way, right? How do we So what we're trying to do is combine those all and have folks who are cross-trained in all of the areas so that somebody can go, it's almost like one-stop shop, right? You come in and we're going to figure out how we get you the help that you need. And you don't need to go to all these different places. Um, and so it just really makes it more accessible, right? And when we think about making it more accessible, that helps our residents succeed more, and we have a bigger impact.
Absolutely. I mean, it's one of those things. It's not some giant innovation. It's just making it easy for people to access existing services can be transformative, when you aren't forcing them to set up 4 different appointments in 4 different office buildings, 4 different sets of paperwork, the whole thing. Can you talk about some of the successes that you both had in Delaware County, but then also what are you looking forward to working on in the coming years?
Yes, I mean, some of the successes, I've talked about them a little bit here, but we were able to create a health department, during the pandemic. It was the
Yeah.
first health department to be created in the Commonwealth of Pennsylvania since 1989, and we were able to work with the state. We were able to work with stakeholders in our community so that we really built it for Delaware County residents. We really thought about it in a way and bringing as many people to the table as possible. So what I mean by that, it took about 2 years to create it. We did a whole process of having roundtable discussions. We had virtual sessions because it was in the middle of the
Right.
pandemic.
Yeah.
With so many different stakeholder groups, whether that was our immigrant community and immigrant coalition, or our school social workers from all around the county, or our hospital systems in the county. Everyone who wanted to have a say in how we built this health department out had an opportunity to do so. And then we built it from the ground up to really serve the needs of our community. And we were able to get approved, and now it's thriving. And so it's been a really great win for the county, but also it's helping us to cut down on the health disparities that exist in our communities in Delaware County, and helping to access more and provide more access of services for our residents. Um, Another one of our wins is deprivatizing the prison. So we actually were able to take the county prison back into county control, and we're able to deprivatize it and take it away from GO Group, who was the private entity that was running the prison.
Can
And
I,
that
can
has
you,
really been
yeah, can you just describe what it takes to move a prison from private back into public hands? Like it's like that's no small task. So for those who
no.
maybe want to do it in their communities or their states, what's that look like? What's your advice?
Um, so we ended up having a working group of county folks, and then we had an outside consultant group that kind of helped us piece through all of the different parts. Because when you think about it, you're like, oh, this is just like another department, but it's not. It's a massive entity. There's a lot that's involved. We made sure that the state was involved and talked through with the state the process, and it did take about a year and a half for us to really fully move that from a private entity back into county control. We had to work through union negotiations and, re-interview everybody who worked there. We had to set up policies and procedures. We had to really kind of build it from scratch while it was still open, right? um, and transition into what we really wanted it to be, right? And so we added more behavioral health services, mental health services, more workforce development services within the prison. We were able to go out for different grants and bring more funding into the what we were providing for residents who were incarcerated in our prison, and really trying to push the number and of folks who are returning, right? We wanted to reduce that recidivism rate. And one of the grants that we were able to get from the federal government, with the help of our Congresswoman Scanlon, was we were able to get a grant that allowed our workforce development team, once again, to expand their services and to be able to be in the prison, helping people build their resumes, helping them practice interviews, lining them up with interviews for when they were released from prison, so that they really trying to help folks get set on a path that's different from what um, had them in our prison in the first place.
Amazing, amazing. So I got to ask, just because I'm a huge basketball fan. You were a college star who played professionally in Europe, and you left that out when we were talking about your career path. But I imagine that there were lessons learned from that experience that have translated into politics and public affairs. And I'm just wondering if you have any insights, as we've just finished the NBA Finals, and now we're all big basketball fans right now.
Yes, yes, the NBA Finals. Go Nova Knicks, right? No, Villanova's in Delco. So, um, yeah, I played Division I basketball, and then I had the opportunity to play in Ireland, professional basketball, and it was a great experience for me. Right, I played basketball my entire life since I was 5, so just the skills that you learn and being a part of a team. I went to the University of Maine. We were a really good women's basketball team. We went to the NCAA tournament. We won our conference championship. And being a part of, understanding that 6 a.m. practices are a thing and working hard and knowing that that hard work is going to hopefully result in, what your goal at the end. And, being able to do that is all part, it all translates so easily to anything, right? It translates to my work in academia, but it also translates to my work in government. Knowing that you're not going to do anything overnight, and being in government, we really learned that quickly.
Yeah.
Nothing happens overnight. It takes time. You got to keep working the process, um, and so being patient, bringing people to the table, understanding that it's not my individual effort, right? It's not. I didn't create the health department. We had a whole team of people who were working on this, and we would not have done it without our team, right? It's always a team, collective group effort, and that's how you get things across in government, right? We also needed our state representatives, we need our state senators, we need our congresswomen, right? We need all levels of government to be working together, and so you really learn about teamwork and how you can move something forward by working together.
Love it. Love it. I always tell the student athletes I have that, like politics, the best part about elections is it's one of the few places in real life where there's like a scoreboard at the end and you know whether you won or lost. And so if you have that competitive fire, translating that into elections and then hopefully into good public policy it's a great way to take that fire that people may have on the courts or in the fields and then apply it in real life.
Yes. Yes.
So I gotta ask because as I mentioned, you are in a swing county, in a swing state, in a swing country. So how are things on the ground in Pennsylvania right now? How is the party being? How's the Democratic Party being thought of by your constituents? How is the chaos in Washington D.C. Being seen on the ground in Pennsylvania? What's your sense from the ground there in the swing state?
People are fired up. It seems, folks are ready to go out. They're ready to help. They're figuring out how they can knock doors, where they can go. Even in a place like Delaware County, people are already looking at, okay, where can we go help? Right? We don't have a competitive seat for our representative here in Delaware County. We've been able to flip several seats, but there's one state house seat that's flippable. And so folks are putting their attention there. But there's also several different statewide, when we look at it, there's several opportunities that we have to send new Congress people to Congress. And they're close seats, and that we should be able to flip if we get the voter turnout. And so folks are looking at how can they go? How can they help? People are asking me, like, where can I go? What door should I knock? What campaign should I reach out to? And then we also have an opportunity here in the state of Pennsylvania to be able to flip our state senate as well, which would be amazing going into next year and being able to really move policies forward. Because as you see, a few years ago, we were able to flip the state house. They've been moving so many policies forward, but they get held up in the state senate, and they're not able to to go, whether we're talking about gun control, housing policies, funding for education, funding for mental health services. All of these things are on the table every election. And even more so now because we actually have an opportunity to move some of these policies forward and move forward with our governor. And he is on the ballot this year, so everybody's excited and ready to go for our Governor Shapiro, and really trying to make a difference here in the state of Pennsylvania. We had the one Senate seat that flipped last year in the special election. That was the first time that it had ever been represented by a Democrat in the Lancaster County area. Looking to do more of that, and they only have a very small majority in the state Senate. And right now, we have a small majority in the state House. So the goal is to expand that majority in the state House and flip the state Senate, while also sending some new Congress members to Washington, D.C.
All right. Well, let's make all that happen. That would be super helpful for all of us, not only for the state of Pennsylvania. I gotta ask, you're extraordinarily talented in several different fields. How do you think about how you allocate your talents and time in a limited lifetime to having the most impact? And in terms of like, what advice do you give to your students? What advice do you give to young elected officials coming up about what they should do and how they should do it?
Yeah, that's a big one, right? There's so much going on, and there's so many issues to try to tackle, right? And I have my core issues, but as you said, health and all policies impacts a lot of policies in
Yeah.
a lot of different areas of government, and it's really about having a great team and figuring out what are your top policies, how are you going to move that forward, what is the goal, what's the 1-year goal, what's the 3-year goal, what's the 5-year goal of where you want to be and where you want to move those policies and how you want to move them forward, and then really pushing towards that. I still work full-time at the university, so I still teach. I'm also a mom of 4 little ones.
Oh my God.
So and so I have a really busy, really busy schedule. But I love it all, right? I coach my daughter's basketball team, and it's another way to be a part of the family, a part of the community. But also, my kids go to all the events. They go to all of our county. I want them to understand what our county is about, and what each little part of our county is so different in a wonderful way. And they should really know about where they live and who's in their community, and how we serve the community.
I love it. So yeah, how many hoopers out of the 4 do you think you have?
Well, so I have 3 older girls, and then I just had a little boy. He is 10 weeks old now,
Oh wow.
and
Okay.
so hopefully he's going to be a hooper. But my 3 girls are definitely hoopers, and they are playing. My youngest girl is 5, and she's been playing for 2 years now. So
Awesome. I got a sophomore in high school she's basketball in, and I'm driving all over the region to watch her play. It's so fun.
yeah.
Thank you for being on the podcast today. Thank you for being in New Deal. It's critical that we have leaders everywhere who can get results for communities. Is even more critical in places like Pennsylvania to have leaders on the ground getting results and delivering, and hopefully building those majorities from school boards to state legislatures all the way up to the presidency. Thank you for lending your considerable time and talent to public service and to the New Deal.
Well, thank you for having me. It's a pleasure to be a part of New Deal, and it was great speaking with you on today's show.
An Honorable Profession is a New Deal Leaders podcast. And because we keep things honorable, no tax dollars were used in the making of this podcast.
This podcast is part of the Democracy Group.